Hello, my name is Daniel Shapiro, and welcome to my Special Populations Power of 3 presentation. The topic I'll be presenting is the transgender population in healthcare. Before we talk about the transgender population specifically, I would like to take a step back and talk about discrimination in healthcare in general. Discrimination can be found within different races, ages, and among those with disabilities. These factors can change an individual's access and quality to healthcare and how a person is treated. It is what will decide if they wish to seek healthcare in the future. Discrimination is a sensitive factor because if it causes someone to not seek healthcare, not only will they be negatively affected, but the rest of the population could suffer as well as a result. In respect to the transgender population, they face their own problems in healthcare when facing discrimination. Being transgender can already cause a person to be confused about his or her body. So when seeking healthcare, the fear of discrimination can cause them to delay seeking their healthcare needs. As individuals, they have needs to seek healthcare when appropriate and not have to fear being different. Ecologically, transgenders shouldn't have to face this vulnerability, so health disparities won't arise in the population. They are no different from anyone else and should not be treated as such. A primary enabling factor that gives rise to transgender vulnerability is lack of physician knowledge. In medical school, physicians are taught how to treat based on biological sex alone. They rarely take assigned gender into account. This ignorance gives rise to less efficient care, which is neither fair nor appropriate for the represented population. Many doctors are too afraid to treat transgender individuals due to lack of knowledge, making it even harder for transgenders to seek healthcare in the first place. Further medical education is necessary in order to fix this gap in knowledge and ensure higher quality care. Vulnerability of transgenders in healthcare lowers their access to care. Transgenders require gender-affirming services such as hormone therapy, reconstructive surgery, and mental health visits. These extra coverages raise utilization costs, causing many to be refused coverage by their insurance companies. Poor health is often the outcome for those who cannot afford these medical costs on their own. The limited coverage, lack of physician knowledge, and fear of discrimination greatly lowers quality of care for these transgender individuals. These risks, along with high medical costs, limits how good of services transgenders can receive. The limited access and poor treatment by physicians hinder the ability to have an effective medical visit. Poor quality lowers health levels, causing huge disparities in global population health. Physicians and insurance companies have a goal to help aid in medical coverage and access for all people. However, the inaccuracy of being able to meet this goal has led to high levels of mistreatment towards the transgender community. This allows for much room for improvement for the transgender community, something we all wish to see in the following years. The transgender population is in a tough spot in regards to facing their healthcare needs. A way to improve this issue can be found within the individual medical facility itself, simply enhancing patient satisfaction. Things like having an effective office staff, use of non-gender conforming forms, and initial health assessment interviews can improve the quality and access to healthcare. Patient feedback is also pertinent in assessing care and can help facilities learn what they can do to improve. Another way to improve upon healthcare for transgenders is by taking a step back and looking at the quality of medical education as a whole. Transgender education needs to be taught in higher level education courses. This will help providers learn the uniqueness of a transgender body compared to a traditional patient. Further training on the appropriate etiquette towards transgenders is also necessary. It will help them feel more comfortable and accepted, in turn allow them to become more willing to seek healthcare whenever appropriate. Thank you for watching my presentation, but before you go, I have some questions to ask. What do you believe caused the great divide of mistreatment towards transgenders in the healthcare community? Also, if you have a future in the healthcare industry, what will you do to ensure quality care and respect towards the transgender community?